and early 1950s were decisive years for India, a newly independent nation. While certain leaders were busy charting the country's economic policies and growth, others were formulating policies that focused on the people's reproductive health, a concept encompassing total well-being in all aspects of reproduction, including physical, emotional, behavioral, and social. These policies led to the establishment of the Family Planning Association of India in 1949. In 1951, the government launched a series of action programs and plans called Family Planning. This move catapulted India into a select group of countries that had chalked out a national family planning program. Later, in 1997, the government initiated the reproductive and child healthcare programs that focused on creating and spreading awareness about various reproduction-related aspects such as contraception and infertility, as well as providing and supporting facilities today. The government, along with family planning experts, is continuously chalking out strategies to address the latest challenges arising in reproductive health. For instance, people in rural India still don't have access to information relating to sex and reproduction. Hence, Hence, various governmental and non-governmental agencies have been roped in to propagate information. Experts associated with family planning have also realized that today's youngsters depend on the internet as well as other sources including movies, friends and magazines to learn about sex-related aspects. However, information gathered from these sources may or may not be reliable. Moreover, at times, the information can create myths as well as misconceptions and even unhealthy attitudes towards sex-related aspects. Therefore, these experts are advocating the need for sex education in schools. They argue that it will go a long way in imparting correct and relevant information about sex. Moreover, it will also make youngsters aware of social evils like sex abuse and sex-related crimes and the steps they need to take to fight such social evils. Experts also believe that people, especially adolescents, should be sensitized to hygienic sexual practices such as cleaning one's genitals, sexually transmitted diseases, AIDS, adolescence, and related mental and bodily changes, which in turn will ensure a reproductively healthy society. Another strategy to improve reproductive health is by educating couples as well as individuals of marriageable age about birth control options, gender equality, pre- and post-pregnancy care, Such education will also decrease maternal as well as infant mortality rates and limit the size of families. In fact, the government had created a strategic plan for 2005 to 2009 that had 5 action areas, namely, providing expert medical care and assistance to people on wide-ranging issues including pregnancy and delivery, STD'S, abortions, menstrual problems, and infertility is another step taken by the government. Moreover, the government has also set up research centers that aim to find solutions to reproduction-related problems. One such center is the Central Drug Research Institute in Lucknow, which is credited for developing Saheli, an oral contraceptive for women. Apart from setting up research centers, the government is also establishing hospitals and medical centers, especially in the rural areas, to provide an impetus to medically assisted deliveries as well as to provide postnatal medical care. This will help bring down maternal and infant mortality rates as well as encourage couples to have smaller families. The government is also conducting mass immunization programs to bring down the infant mortality rate. Did you know that the government has